In this episode of the Courageous Public Health Podcast, Chioma Nnaji reflects on what happens when we're clear about who we are, what we value, and why we do this work. From choosing purpose over a higher salary early in her career to reimagining what community-led public health can become, Chioma shares how moving with intention has shaped both her leadership and her vision for the future. This conversation explores courage and purpose, authenticity, community, and what becomes possible when we stop reacting to the moment and start making decisions that are aligned with who we want to be. You're listening to the Courageous Public Health Podcast, episode 68.
To all the courageous women leading in public health, this podcast is your space to turn up the volume on your courage. This space centers your voice. This space celebrates your passion. This space amplifies your courage. My role? To listen, to amplify, and to stand with you in the fight for equity. My name is Dr. Christy McClamrock. I am an epidemiologist, consultant, the founder and CEO of Courageous Public Health, and the host of the Courageous Public Health Podcast. Each week, I have real, unfiltered conversations with women in public health about the challenges you face, the power you hold, and your vision for the future. We talk about the authenticity, vulnerability, and courage that you bring, not just to public health, but to every part of your lives. Because courage is about action, even in fear. It's about taking up space, leading unapologetically, refusing to be erased, and knowing you never have to do it alone. If you're ready to turn up the volume on your courage, if you're ready to take up space, if you're ready to smash the racist, patriarchal, cisnormative, heteronormative, ableist, capitalistic systems, then listen to this new episode.
Hi there. Welcome to the Courageous Public Health Podcast. I'm Dr. Christy McClamrock. We don't always know exactly where we're headed. We weigh our options, we think through possibilities, and then sometimes something becomes clear. Not because all the uncertainty disappears, but because we're grounded in what matters most. Through Courageous Public Health, I partner with leaders and organizations to create space for these kinds of conversations, because clarity isn't just about knowing where we're going. It's about understanding what we're unwilling to leave behind as we move forward. Today's conversation is with Chioma Nnaji. Chioma Nnaji is an ethnic blend of egusi soup and fufu from her father, who is from Imo State, Nigeria, and okra gumbo packed with everything from her mother. Both her parents and the village that raised her instilled in her the importance of community organizing, justice, and staying grounded. Those values have guided her work over the past 20 years at the intersection of HIV/AIDS, public health, racial justice, and immigrant rights. Chioma began her career as a community organizer and community health worker, eventually leading initiatives in community-engaged research, capacity building, and community mobilization. As a trained and experienced facilitator, she founded OCHA Transformations, a firm that brings leaders, organizations, and communities together to maximize social impact and sustainable change. Chioma is constantly seeking innovative ways to build partnerships, think differently about problems, and challenge dominant narratives. She has served in leadership positions across academic and community institutions and grounds her work in equity and justice with a particular focus on the meaningful engagement of people impacted by intersecting oppressions. Here's my conversation with Chioma Nnaji. Hi there, everybody. Welcome to the Courageous Public Health Podcast. I'm excited to introduce a new colleague and, may I say, new friend, Chioma Nnaji. Really excited to have you, Chioma. How is it going today?
Everything's good. It's good. It's a good day.
It's a good day. Good. I love that. It's a good day. Yeah. Well, we've already been laughing together before even hitting record. So
and holding grace for each other too.
Which is, I'm so glad that we can do that. And so, yeah, I want to start off by having you introduce yourself to our listeners.
Yeah, it's interesting because I always struggle around how I introduce myself. You know, of course, I like to center who I am in terms of the values I hold and the ways in which I move in this world, and it's really very much grounded in my upbringing, right? I sometimes call myself a Southern villager because my mother is from Shreveport, Louisiana, which is the South, right? And my father is from Nigeria, West Africa. And I'm intimately connected to both. And so you see that in everything I do, from, how I talk to how I move to where my values are. And one of the things I appreciated living in a household where both of those identities and cultures and traditions existed is that it allowed me to see the similarities, especially when we talk about Black communities, and appreciate those similarities. And it also allowed me to see the differences and celebrate those differences. And I think often that's what gets missed when we talk about coming together as a collective, as a community, as a partnership, to do work together, that we always want to focus on what do we have similar? What do we have, but sort of that upbringing allowed me to appreciate the differences and the way those differences have influenced my own thinking and my own way of life. But my background is public health, and I work at the intersection of public health, immigrant rights, racial justice work. And a lot of my work is centered around community, the ways in which community lead, the ways in which we can create community-driven systems and processes, and also thinking about the ways in which communities have the answer, and how sometimes we need to, or most times we need to disrupt systems and disrupt the ways in which we think in order to create space for those answers. So that's a little bit about me.
That's a little bit about you.
Yeah.
Okay, so I have to say that we have something in common that we didn't realize we have in common, which is Shreveport, Louisiana. My dad grew up in Shreveport, Louisiana.
Nobody knows Shreveport.
I know Shreveport. I know Shreveport so well.
Oh my
yes.
God.
My dad's whole family.
There. Oh, really?
Yes.
Oh my gosh, that's amazing. People know New Orleans, even Baton Rouge, but Shreveport, they're like, what? But Shreveport, yeah. Oh, wow.
And
we might be family. We might be family.
We might be.
Shreveport is that small now. We might be family.
Is that small. And I feel the same way. I did not grow up in Shreveport, but my grandparents were in Shreveport, so we would go back and visit. And my mom's family was in Dallas, Texas. Shreveport and Dallas are also a huge part, even though I grew up in Ann Arbor, Michigan. Yeah. The only person in my family to grow up outside of the South. Mm-hmm. Those places are a big part of me as well. Yeah. Oh, wow. Wow. Even though you would never guess it by my accent.
Yeah. We'll add that to the list.
Add that to the list. Yeah. Love it. So yes, we have some differences, but we have some really cool similarities as well. Yeah. That's great. See why it's such an exciting thing to be able to introduce yourself, not just based on your professional bio. I think that's I'm glad that I've been asking that question, because I think it gives them
it supports people to really also ground themselves in why they do the type of work that they do.
Yes.
And I know for a lot of us who are so passionate about doing this work around equity and justice and liberation, that we're wrapped up in that world, and because it's so personal. But sometimes it's good to step back and say, like, where did it come from? Where did that connection and that passion come from? And how are we ensuring that we're still living out sort of the initial reasons why it became so important to us, right? And we're not getting caught up in the same area and space and ways of operating that we are so constantly fighting against. So
yeah. We had a offline conversation about my necklaces with my words, which I've mentioned on other podcast episodes. And today I'm wearing liberation. And
wow.
Just use the word liberation. So
wow.
I'm telling you.
I don't know what's going on with us, Christy. I don't know.
I don't know. It's exciting though. Whatever it is, it's very exciting.
We'll let it work.
We'll let it work. Yes. Okay. So I want to get to our first question, which is about courage. And I do like to remind everyone listening how I think about bravery versus courage, that bravery is about taking action without fear, while courage is taking action despite fear.
Yeah.
And I also, just because we were chatting about this before as well, this idea that courage is about taking action that is aligned with our values and our vision.
Yeah.
And so I would love to hear from you some examples of when you've acted courageously in your professional life, in your personal life, whatever you'd like to share.
Yeah, I mean that first, I appreciate this question. I appreciate always the opportunity to reflect. And it really made me sort of think about my why. And maybe that's sort of the energy right now for me as we talk, like, what is my why? And I remember, like, when I started thinking about, like, why am I doing this work, right? And I remember an incident when I first decided to go into public health. Okay, like, I graduated with my master's in public health at Boston University. And I decided I was going to take some time during the summer. Well, this was before I graduated, but to do my thesis and all that so that I can graduate. And so I was like, well, let me just go volunteer because I have time that I need. I'm going to be in the library 12 hours. What am I going to do the other 12 hours, right? Like, sleep for 2, and then what am I going to do for the other 10? So I was like, let me go and just volunteer. And so I had this opportunity to volunteer at a grassroots organization here in Boston. Really loved and enjoyed the work. I thought that I was going to graduate with my master's and go and work somewhere in West Africa and working with the NGO and doing all that kind of work. So I had no intentions on staying in Boston, much less like staying in the United States of America. So then I had this opportunity. I was volunteering at this organization. Someone saw me and asked me to apply for a position. So I was like, okay, let me apply for the position. Apply for the position, got the position. Okay. So now I'm like, oh, wow. So then I was like, okay, let me tell this nonprofit that I'm volunteering at that I'm going to stop volunteering. I'm going to work for this other company. And immediately they were like, we'll offer you a job. Now there was distinct differences between these jobs, right? First, one paid more than the other. Guess which one did? Not where I was volunteering.
Yeah.
Second, the other one put me in a more, I would say, management position, right? Which, sometimes gives you more status and more sort of flexibility. And so in that moment, I really had to ask myself, but when I wake up in the morning, what's going to bring me joy, right? When I wake in the morning, what's going to get me excited? What's going to make me want to, like, work when it gets hard? Or what's going to make me want to work when, the community, because it was HIV/AIDS work. So work when the community wasn't really trying to hear about HIV, right? Because they're dealing with, housing, or dealing with, what am I going to eat today? And so I made a decision to stay at this nonprofit organization, grassroots nonprofit organization. And I had the privilege of working there for more than 20 years. And so, wow. That sort of, I think, set the stage for how I make decisions moving forward in my career. Like, if I'm not getting up every morning and smiling and excited about what I'm doing, that means it's time for me to go, right? That means it's time for me to do something different. And so that's sort of where I measure, right? Like, yeah. where I measure what I'm doing every day and making sure that, and excitement doesn't mean there aren't hard times. Like, you're going to have hard times, but it means that I'm willing to fight through and struggle through those hard times because I know the work is valuable and I know the work is beneficial to the communities that I care about.
That's such a great, that's such a great example.
Yeah.
And, staying connected to those values and that vision. I mean, that then to me, that means that then the work is so much more powerful and you're so much more able to show up for that work with your full self.
Yeah. And I know it's not that easy of a decision for everybody, right?
No.
Like that's a privilege. I will call it a privilege because sometimes folks got to do work because they have bills to pay, or they have to do this work because they don't have any other option, right?
Yeah.
I've had friends who decided to get other jobs because they pay more because they have kids that they need to send to college, right? And it's not necessarily a job that they want to do. And so it is a privilege to be able to make a decision, right? To be able to have options that you can make a decision on. But yeah, I remember when I did that and I told my father I was going to take the job that was going to be $15,000 less. Look, I'm not talking about 2,000 or 3,000. I'm talking like $15,000 less. And my dad was like, "What?" And at that time, also, public health became a thing at COVID-19. That's when public health became sexy. Like at COVID-19, public health became sexy. So we're talking about 25 years ago. And my dad was like, "Public health." Like, even that public health, community health, like you want to work in community and do organizing and advocacy work and talk to people about HIV. So it was, it was interesting, but it's sort of defined, it defined who I wanted to be in doing this work. So I'm grateful.
In some ways, I think that, HIV got public health a little bit on the map, but it definitely wasn't sexy back then.
Oh, that's yeah.
And you're right. That COVID-19 gave us a little bit more clout, a little bit, but it's been around forever.
The beginning of time, and a lot of folks don't connect different things to public health, right?
Right.
Like it's not just disease and conditions and managing medication. It's you being able to have drinking water coming directly into your house, right?
Right, or into your cave.
Yes.
That's the beginning of time.
Right. I mean, it's some of the simplest things that we take for granted every day is because of public health that we have them.
Yeah.
Because of public health that we have them.
Yeah, I think I always think about the way that I see the world through a public health lens. Mm-hmm. I see everything through a public health lens. And sometimes I forget that that's not very common. That's not how most people see the world. But yeah, it's like for those of us who have studied public health and worked in public health, it's like, oh my gosh, long lost friend, where have you been? It resonates so deeply.
I mean, I think public health allows you to see how all the things are connected.
Yes.
It allows you to see why, how education is connected to how people make decisions about their health. It allows you to see what does it mean to have, housing and how that's connected to people being able to access healthcare, right? Yeah. What does it mean to just have green space in your neighborhood and how that's connected to people being able to be mobile in their neighborhoods, right? Like we understand the bigger picture. And sometimes the way the system is set up is that unfortunately we're still stuck in analyzing these bigger questions, right? Social political questions related to health. We still analyze them in very isolated ways, right? And that has to do with sort of how funding is released, cancer funding over here, diabetes funding over here, HIV funding over here, right? How the system is set up, right? All these specialties. so it makes it even hard to do public health in the way in which we know it needs to be done.
Yeah.
The way that it's complex, it's multi-layered, the way that we have to think multi-section across sections, right?
Yep.
It makes it hard to do that. And, in this moment in time, it's even harder because of the social political environment. And I keep pushing us as public health folks, our public health adjacent folks, even how we using this time to rethink how we want to do public health, because we're gonna have to rebuild all the shit that has been broken, right? Like we're gonna have to rebuild it, right? And so we need to be thinking now, how do we want to rebuild it in a way in which it really achieves the goals of public health. And for me, that means we're rethinking, we're doing some visioning work, because when we also can't go back to what we had, because that wasn't for everybody, right? It didn't meet the needs for everybody. So how are we using this as an opportunity?
Yeah. I like the idea of revisioning, reimagining, and actually starting there before we rebuild.
Yeah,
we actually have to know where we're going.
Yeah.
Like, where do we want to go? So
we want to color outside the box. We need
to. Oh my gosh. And so I mean, I know a lot of people are having conversations outside of public health. Public health people are having conversations outside of just public health, right? To start thinking about this. And one of the things that I really love about doing this podcast is that it gives me an opportunity to keep talking to the people who are also in public health, who do share that lens. That reinvigorates me. Because it can be really challenging to then go and have the conversations with people who don't understand.
Who don't get it.
They don't get it.
Right.
And some of those people are unfortunately the ones that have the most power. So, Any other examples that you want to share?
It's interesting because I was like, oh God, is this going to be a therapy session? Because I feel like I'm
just a little bit
now. Like I'm in the moment of needing to be courageous right now, like in my life right now. Goodness.
Do you think that happens a lot, right? It's
every moment in life could be that.
The host and the guest often have moments of being courageous in real time,
right?
As this is being recorded,
right? Like this is like as we're talking. It's interesting because I'm in a point in my life right now where I'm very clear about my purpose. I'm very clear about my purpose. I'm very clear about what I want to do. I'm very clear about how I want to use my time, right? Somebody told me that in your 40s is when things like become like aha, right? And you work the hardest in your 40s to get to that, I don't know if that's true. I haven't hit my 50s. I don't know. But I can say right now in my 40s, like I'm very clear. And so I'm at a point where I want to invest in what I call my legacy work, right? Like, because I'm very clear. Right? Like it took me a while to get clear on what I want to do, but I'm very clear. And so what does that mean to invest in your legacy work? For me, that means like, what is the type of work you want to do for the rest of your life? Or even what is the type of work you want to do until you feel like you don't want to work anymore? Right? Right? For me, it's even, if I like unpack that a little bit more, for me, it's like not even work. Cause I also have conversations with my friends who are like, Chioma, like, your work. I'm like, but that's my passion. Like, I don't know how to explain to you because you don't like your job. So I can't explain to you. Like, we're not even starting at the same we're not even starting at the same place. Like, you don't even like your job. So I can't even explain to you what it means to, but it's interesting to be in this moment, because it's challenging me to think about, how I can move forward with intention. And I think so. And right now it's also, and that's where for me, sort of the courageous comes in, like being courageous, because moving with intention doesn't always mean like you know where you're going. A lot of it is about gut.
Yeah.
You know, a lot about it is like, I feel like this is the decision I need to be making. I feel like this is the way I need to go. Or, you know, depending if you're a spiritual person, I'm a very spiritual person. Like, this is what like my spirit is telling me I need to do. And I'm going to go in. What intention means I'm going to go in 100%, right? Like I'm not going to half-ass it. I'm going to go in. My mama used to say, stop half-assing. You know, I'm like, that's very southern. Don't be half-assing. Okay. So I don't know if you need to cut that out because I'm cussing, but.
I know that phrase really well.
Okay.
My family uses that phrase a lot too. So, yep.
So right now, I would say right now is a moment of, and I haven't come out of like what it looks like, you know, whatever, but moving with intention, and just knowing that I'm going to land where I need to land, because I'm clear. Yeah.
The piece about like you can feel it in your gut.
Yeah.
This is, you know, the idea that sometimes the body knows before the brain knows. The body knows. And so we get to, you know, slow things down enough so that we can actually hear what our bodies are telling us. That's something that I've really been thinking a lot about lately and really trying to lean into is like, you know, instead of walking around like a head that's disconnected from my body or is just like, oh, the purpose of my body is to carry around my head. What do you mean? Right. Like, what else is it for, right? And now it's like, no.
Yeah.
I get to.
You have to tap in. Yeah, that's very, very true. Very, very true. Because when our mind gets involved, we start talking ourselves out of it. I start second guessing it, and it becomes something totally different. Then we're like, why didn't that work out? Because you didn't listen to your gut in the beginning, right? Like, right? So,
yeah.
Oh.
Yeah. I think it's also, at least for me. Okay, so my mom used to have a bumper sticker, but not on the car. It was actually like tacked up on the cork board in her office, which was had been my bedroom before when she turned my bedroom into an office.
I feel like there's a story there. I feel like there's
there's no resentment there at all. But yeah, so this bumper sticker said, "You don't have to believe everything you think."
Oh wow! You don't have to believe everything you think. Wow.
You don't have to believe everything you think. And it literally took me decades to understand why did she have that? She didn't have any other bumper stickers up. Like, why did she have that phrase there? And, you know, for me, like, my thoughts will come in and they'll say all these like crazy things, tell me that I should be afraid of things that I actually don't need to be afraid of, or tell me, you know, all the ways that I'm not good enough, or, I mean, it's just so many thoughts that's actually something that, for me, like learning a little bit about mindfulness and being able to be like, you know what, the thoughts can come and go. You can actually just like watch them, like you're on the side of the highway and you're just watching the cars go by, and you don't have to chase after each one. You don't have to believe each one. So that just what you said reminded me of that bumper sticker. Yeah,
that's a powerful statement, and we have to train ourselves on how to do that.
Yes.
You know, because we've been socialized that, you know, you have to keep going. You don't need to pause. You don't need to reflect. You just need to, you know, act and keep, you know, we've been socialized in that way.
Totally
so we have to
socialized.
retrain ourselves to slow down. And slow down doesn't mean you're stopping something. It just means you're allowing yourself to pause and reflect and sort of decide which one of those thoughts makes sense and
Yeah.
which, you know.
Yeah.
Yeah.
Which one of which one of those thoughts are actually things that you want to choose to believe? Because we
Yeah.
actually get to choose what we believe,
Yeah. Yeah.
right?
Yeah.
And which of those thoughts are aligned? We're back to where we started, which is like which one of those thoughts are aligned with our values and our
Oh
vision.
yeah, absolutely. Absolutely.
Nice. See, we brought it
Absolutely.
all the way around. Beautiful.
Absolutely. Yeah. Yeah.
So let's talk a little bit about authenticity, because I think authenticity is another important part of courage.
Mm-hmm.
And I think about, the way that we're authentic really relates to how then we can express ourselves,
Mm-hmm.
especially in spaces that might not always welcome our power. We can
Mm-hmm.
express our power even when it's not welcome. And so I'm wondering what your thoughts are about that, and what your sort of experience has been being in those types of spaces and leaning into your authentic self anyway.
I laughed, when I saw that question, I sort of laughed
Yeah.
because my mother says I've always moved with audacity. Like, and I have this picture of myself and my two sisters was sitting on the couch, and my mom took this picture. We're like in our Sunday, dresses or whatever.
Yes.
And my sisters are sitting all, and I'm sitting like with my legs crossed, with my arms crossed.
Yes.
And I'm like, oh, that's what she meant. like I've always just showed up the way that I wanted to show up, right?
Yeah.
And so I've realized that I've always had this I don't give a F sort of attitude. And that doesn't mean I don't give a F about people, about what's going on in that space. But I've always been like, I don't care, because I'm going to show up the way I need to show up, right? Now, what I've seen or what I've experienced or reflected on for myself is that show up has looked different over the years, right? Like there's times, like I can tell you times where I've showed up and, I'm very vocal, and I'm very, I'll use all the F words. I'll use all the 4 letters and letter words and do all the things, right? In spaces where I feel challenged, or I feel my community is being invisible, being excluded, or I feel like there's harm to my community happening, like I'm all 100% in. And, and then there are times where as I've grown in the field, I want to use the word mature, but I feel as though that gives a way for people to weaponize when folks show up in certain ways. So maturity, I'll use that lightly, because I don't think necessarily yelling and cussing is immature. I think that there are different tactics that need to be used in order to address things with from harm to trauma to all the things that we deal with when we're doing this type of work. I'm seeing that, there's a shift in the way that I am presenting in spaces that I know are going to be harmful to me, right? And so are going to challenge me. Let me say that. Because I also choose not to be in spaces that are harmful, but that are challenging. And so now it could look like sitting, thinking, taking a pause, breathing, right? Posing questions that will get folks to think, or posing questions that might be a little sarcastic so I can get my point across, right? Like now it looks a little bit different without me saying that, like I can go to other places if needed, right? So I think that now I have more tools in my toolbox to be able to show up in ways in which I feel like I'm showing up authentically. And it's challenging to sort of be able to navigate that because of how we're socialized to think what is professional, what is not, how we're socialized to think about, what behavior should show up in what kind of space. And then, like, who's doing it, right? Because it's acceptable for maybe you as a white woman to do it and not acceptable for me as a Black woman to do it, right? And so all these things that we're navigating, showing up authentically is challenging and difficult. But I'm glad that I came out the womb not giving the F, and I've been able to sort of gather different tools and strategies in my toolbox along the way. I haven't arrived. I don't want to say I've arrived, but it's still a work in progress.
I'm imagining you, coming out of the womb with your arms crossed, your legs crossed.
With all kind of attitude.
All kind of attitude. All the attitude.
All the attitude. Like, I told y'all, I wanted 2 more hours. Yeah.
Oh my gosh.
That picture. I'm going to send you the picture. It's very telling.
Yes, I want to see it. I totally want to see it now. That's great.
It's very telling.
Yeah. Okay, Chioma, we've already talked a bit or hinted at this idea of vision, but I am so excited to hear from you about your vision, and your vision for public health, your vision for the work that you're doing, and your vision for yourself.
Yeah.
Talk to me about vision.
These are big questions.
I didn't warn you ahead of time at all.
Big questions. My vision for public health is that public health needs to come back to its origin. And for me, the origin is community-driven, community-led. That's my vision for public health. And I tell folks, like, we've tried everything else. You know what I'm saying? Like, we've done, like, and so when people talk about public health, they talk about community this, community that. Let's do it.
Yeah.
Let's put that in practice, right? Let's figure out, let's know how. And I think COVID-19 was actually a very good example of how this is done, where you saw across the country, the states didn't know how to do what to do. The feds didn't know, the federal government didn't know what to do. Like, nobody knew what to do, but community did, right? Yeah. And so there were a lot of grassroots organizations, a lot of community leaders that were like, give us the money so we can save our communities.
Yeah. So
we can save our mother, so we can save our sister, our cousin, our best friend, like, give us the money. And what was happening across the US, states, foundations were like, here's $15,000, here's $20,000, here's $100,000. Just fill out these 5 questions and send us a report at the end.
Yeah.
So if that worked during COVID-19, and that's the only way that lives were saved, right? That's the only way that lives were saved, that we were able to get people screened using, getting tested, getting vaccinated, people, really understanding what safety protocols were about. Like, that was the only way, because folks on the ground were organizing and had the resources, because they already have the power, right? Like, community has power, but had finally the resources to do what needed to be done in its full capacity, right? Mm-hmm. And so for some reason, we've gone back to what we were doing. Right? Like, a majority, like, we've gone back to the way that we've been implementing, like, interventions and programs and all this stuff. And there are some places that they're like some cases that I know of that there's like, they're doing and trying new things, like some foundations that are really getting into trust-based, practices. There are foundations that are really focused on how do we directly, like, as a strategy, as a core strategy of our work, how are we directly funding communities? Like, there are sort of places that are doing things differently because of our current social environment. But, public health for me is about getting back to community-led and community-driven.
I love that so much. And I'm just struck by this idea that, when we did that, we scared the hell out of some people.
I think we did.
I think we really scared. We scared the people at the highest level, levels of
Yeah.
power.
Yeah.
And that's part of the backlash that we're seeing right now.
Yeah, I agree. I agree 100%. I mean, and it's, it's simple. It's simple and it's complex. Like I'm not saying that it's something that we can do in 3 months, but I am saying that it's doable because we've done it in different ways in different spaces. And so, you know, we need to look at this, everything from governance to financial resources, right? To ways of organizing advocacy and policy development. Like in every aspect of the work, we need to be thinking about what does community-led, community-driven look like. In research, what does it look like in practice? And how do we sustain it? I talk a lot about community-led research because of several initiatives that I'm part of, collaboratives. They're not even initiatives because they're solid, sustainable collaboratives that I'm a part of. But and sometimes people take that as, particularly academics, take that as like, okay, what's our role, right? Because I'm like, we should directly be funding community-based organizations. They should be receiving the research dollars. They should be defining research questions. They should be leading the implementation of research. They should be designing the dissemination strategies. They should be doing all these things. And so academics are like, well, what are we here for? And I'm like, just because there's a shift of power.
Yeah.
And that you understand, that tells me you understand the impact, right? Like you understand that there's a shift of power. So just because there's a shift of power doesn't mean you have no value.
Yeah.
Right? It means you have value in the way that community is able to define, right? Yeah. And it means that you show up differently in these spaces where you show up as someone who is a collaborator and is a partner versus someone who is taking and not giving back and all these things, ways that traditional research happens. So for me, it's like, how are we thinking about community-led and community-driven in all the spaces that public health work, right? And all the different levels and sectors. Yeah.
And that, I mean, there is a place for everybody in the vision that you're describing.
No, absolutely. Because there's a lot of work to be done.
There's a lot of work to be done. Mm-hmm. It might look a little different than it's looked before, but it also might be a lot more effective.
Yes.
And equitable.
Yeah. Yeah, that's my vision.
Yeah, that's a I like your vision. Tell me about your vision for yourself. What's your personal vision?
Oh, gosh.
I know sometimes that is actually the hardest question of the entire interview.
Let me just be. God. I'm like, can I just be and just do what I want to do? Like, yeah. I mean, I referenced earlier like my legacy work, which is, that's what I want to do, right? Like I already wake up every morning enjoying and finding joy in what I do. So, I told you I made that decision a long time ago. So now for me, it's about like, how am I going to live out my purpose and do my legacy work? And so I'm really focused on community-led, not community engaged, not community-driven, but community-led. I'm very focused on working with African immigrant communities, African diasporic communities. So really focused on Black-led strategies and initiatives and ways of knowing and system change. Part of two amazing projects that are focused on that. One is focused on the African Immigrant Health Research Collaborative, which is a community-led research collaborative focused on African immigrant health. And really focused on ways in which we can implement research. We call it Africanizing research. So how do we decolonize research methods that are really based on Western ideology and Western thought and Western ways of knowing? How do we decolonize research in its practices that allow for other ways of knowing, right? Other worldviews, other ways of understanding what is research and how research should be done. So I'm excited about that project because we're able to develop, in that project, we're developing a framework and we actually get to test that framework. And then there's another project that is focused on what would it look like if the public health research enterprise was led by Black people. And so this project is led by United We Rise, which is a Black-led intersectional collaborative focusing on ending the ending HIV within Black communities, because we know that if we end HIV within Black communities, everybody else is going to be all right, right? Because Black communities are highly impacted, whether you look at it across gender, across sexual orientation, across age, highly impacted. And so that's going to be an exciting project. Like, we're going to be able to use like human design, methods to really sort of look, what would that look like? And then take it out to the community and get community feedback and do all. So that's the kind of, that's what I call my legacy work. Like, how am I focusing on reimagining and redefining our public health system in the aligning systems from the lens of people who look like me, Black communities. Yeah. So
those both sound like really exciting projects. There's so much more than just projects. That's not even the right word. But
so we'll see. I know it's, it leads to something great. And so the goal is that it's going to lead to ways in which we can really have a different type of public health system that will support everybody and in their wellness and thriving and all these beautiful things that we say that public health is supposed to offer people. In communities.
You are truly taking on the systems, which is, well, thank you for being here. It's always so much fun to talk to you, and also, it's fun, and I get to laugh and I get to smile a lot, but it also gives me, a lot to reflect on, and you always help, widen my thinking about all of these things, and so I'm very I appreciate that.
Thank you for having me.
So I want to make sure that our listeners know how to connect with you. What's the best way to do that?
The best way is LinkedIn. So hang out to me on LinkedIn, DM a connection. And
that's how we found each other. That's how I found you.
Yeah, that's how we found each other.
LinkedIn.
And it worked itself out from there. So
it did. We will include your LinkedIn information in the show notes to make it easy for people to connect. Great. Well, I hope you have a really great rest of your day. And I'm glad that we're connected now.
Absolutely. Thank you again for having me.
Yeah. Okay. Talk to you soon.
All right. Bye-bye.
We don't always know exactly where the road will lead. We don't always have certainty, and we don't always have all the answers. Chioma Nnaji reminds us that clarity doesn't come from controlling every outcome. It comes from being clear about our purpose. And when we're grounded in that purpose, we're able to move with intention, even through uncertainty. If this conversation resonated with you, connect with Courageous Public Health. The links are in the show notes. Until our next episode, stay courageous.
Thank you for listening to the Courageous Public Health podcast. Visit courageouspublichealth.com to find the show notes for each episode and learn how to connect with us.